Hey everybody, Sanjay Gupta, medical correspondent here at CNN. We're here in the CNN newsroom here in New York with this Facebook Live. You know, there's been a lot of news, as you've probably heard over the past couple of days now, about what happened to Secretary Clinton over the weekend. Just want to give you a quick update on that and bring you up to speed and hopefully take some of your questions as well. What we know, what happened on Sunday was that she had left an event. It was a 9/11 event, and got to her van where she was waiting to be picked up. And there was video that saw her as she was getting to the van really have some significant difficulty. She seemed to lose her balance. She stumbled. She had to be sort of carried into the van by Secret Service agents. It was actually quite startling to look at. We didn't know what had happened to her. We heard subsequent that maybe she had overheating. They said it was because of the medications that she was taking, one for thyroid medications, one for antihistamines. And then we subsequently learned that Secretary Clinton, in fact, has pneumonia. And that pneumonia had been diagnosed on Friday, 2 days before this episode actually happened at the van. We don't know much more than that. We know that she has a pneumonia. We don't know much more about that. We only know that she's at home recovering. But at this point in the campaign, just under 60 days left to the election, as you might imagine, everyone is talking about this, and a lot of questions coming up about her health, and also about Mr. Trump's health as well. So what kind of questions do we have, Eric?
People are asking what different kinds of pneumonia are there?
Different kinds of pneumonia is the question. You know, it's interesting. So, and I want to make another point again, is that we don't know specifically what she has, but we do know there are different types of pneumonia. A pneumonia is an infection of the lungs. That's different than bronchitis, for example, which is an infection of the upper airways. People who just have an upper respiratory infection, that's the area between the lungs and your mouth and your throat. With pneumonia, it's an infection of the lungs. It's typically diagnosed with a chest x-ray. Someone has a fever, someone will have an elevated white blood cell count. They're going to feel crummy. We know that she, for several days, had this cough. She thought it was allergies. It may have been allergies, but it's also what apparently made her go to see the doctor on Friday and get this diagnosis. The different types of pneumonia can be caused by a bacteria, can be caused by a virus, can be caused by a fungus. We know that she's on antibiotics. So there's some suggestion that her pneumonia is actually caused by a bacteria. But again, we don't know. We do know that they're more common in people over the age of 65. People at that age group are going to be more vulnerable to pneumonia in the first place.
Gina wants to know on Facebook, she's saying bacterial pneumonia is contagious. So why would she want to be playing with her two small grandkids at her daughter's apartment?
Yeah, I don't know if you could hear that, but Gina is asking about bacterial pneumonia being contagious, and we heard that Secretary Clinton had been playing with her grandchildren on Sunday. Couple things. First of all, yes, Gina, you're right. Bacterial pneumonia can be contagious, and we also heard that several people within the Clinton offices also got sick. At least one person became quite ill, had to go to the hospital. What we also know is that with bacterial pneumonia, typically once you start taking the medications, once you start taking the antibiotics, you, within a short time, really are not contagious anymore. That's what we know. That's also what we're hearing she was told by her doctor. So if she was playing with her grandkids on Sunday, she had started taking her medications on Friday, she was likely told, may have been told by her doctors, that she was no longer contagious and would not make her grandchildren sick. So that's the big thing. I also want to point out, you probably saw that video of the van. If you haven't seen it, watch it. You can see what you think for yourself. But then also look at a video that was taken about 90 minutes, 2 hours later, when she's walking out of an apartment building, Chelsea Clinton's apartment building, and she looks pretty good. She's waving to reporters. She's posing for pictures. I bring that up only to say that whatever the event was that happened on Sunday morning, it seemed to be a rather temporary event, a rather short-lived event, because she looked pretty good a rather short time later.
There's some questions coming in. They're asking if this could have any impact on carrying out presidential duties. Should we be worried?
This is the question. The question: could this have an impact on carrying out the presidential duties? This is the question, right? That I think everyone's asking. Why do we care? Should we care? Do we have the right to care? She's a presidential candidate. We know either she or Mr. Trump will become president within the next couple of months. I think that first of all, there's no no evidence whatsoever that this would impact her ability to do the job of president. It sounds like what she has is something that's very treatable. She's getting treatment. She probably will make a full recovery. It's not that uncommon for people to have pneumonia and to get treated for it. She may even have what's colloquially referred to as a walking pneumonia, which is even a less serious version. I think that the bigger question for a lot of people is, when does the public have the right to know about something like this? If she was quite sick enough to the point where she went to the doctor, got a chest X-ray, had a fever, had abnormal blood results, does the public have a right to know? And that's the big question that's coming up. It's coming up big time over the last couple of days, but it's come up almost since I've started doing this job over the last 15 years. What is the public's right to know? And I can tell you that the Clinton campaign seems to have heard this, and also the Trump campaign seems to have heard this, because we're now hearing from both those campaigns that within the next few days, we're going to get more medical records and get better insight into the medical history of both candidates, Mr. Trump and Secretary Clinton.
There's a question coming in about age, asking if pneumonia, if the symptoms become more severe the older you get.
I think with regard to age and pneumonia, there's a couple things. First of all, it tends to strike people in certain age groups. So people who are older are going to be more likely to get pneumonia, typically 65 and older. Also very young children are more likely to get certain types of pneumonia. And we also know, for example, that if you have an underlying illness of some sort, if your immune system is compromised in some way, you're more likely to get pneumonia. So it can be more serious, certainly in someone who is older. But keep in mind, those are the ones who are typically going to get it in the first place. So that's who is typically treated for these types of pneumonias.
Jermaine on Facebook is asking if she should be on bed rest.
Jermaine's asking about bed rest. Jermaine, I'm not her doctor, and I know you know that, Jermaine, but I pointed out again to say that there's a lot of people who are making a lot of recommendations from afar with regard to Secretary Clinton, with regard to a lot of people. I don't know that she needs to be on bed rest. Certainly her doctor said that she should rest, that she should rehydrate, and she should recover. And I don't think that necessarily means she needs to be at bed rest, but I do think that the decision was made not to have her fly across the country to California today for these fundraisers, because flying like that, it obviously can be taxing on the body, but it can also perhaps make the symptoms of pneumonia worse. Not necessarily the pneumonia itself, but it can make the symptoms worse. So what we're hearing from the campaign and from her doctor is that rest is recommended, but not necessarily bed rest. I think we're going to see her still up and about, even if she's not traveling.
Could you talk a little bit about what kind of information we would see in their medical records? Yeah. What red flags should we look out for?
So if we do see these medical records, there's a couple of notable things. I'll talk about Secretary Clinton. We know that back to 1998, she had what are known as a DVT, a deep venous thrombosis. That's a clot that can form in the leg. The big concern about that is that it can break off and go to the lungs. That's called a pulmonary embolism. We know she had that back in 1998. We know she had that again in 2009. And we know at that time she was actually put on blood thinning medication. And this is all what we're hearing. We would confirm this, obviously, by looking at the medical records. She was put on those blood thinning medications. 3 years later, we know she had an episode where she fainted. She hit her head, and she developed a blood clot in one of the blood vessels around the brain. That's what we know. We don't know. We've never seen the CAT scans of her brain, the MRI scans of her brain. We know that she had follow-up testing after that injury, but we don't know what that testing was specifically. These are the types of questions that you want to come out with. I will tell you, Jermaine, that doctors and journalists are similar in this way. We always want more information, usually more information than we have. But the reason is that you never know what you're going to learn. You never know what you're going to find. They are entitled to privacy, to a certain amount of privacy. But if there are things in those medical records that could affect one's ability to carry out the job, things that can affect the brain, the heart, the lungs, concerns about shortening one's life, those are the sorts of things that we'd be looking for. Those would be the red flags.
A question coming in from Alexander on Facebook asking what's a typical recovery period of pneumonia?
Typical recovery period. So this is it's an interesting question again, and this is going to sound a little bit inside baseball, but stick with me on this. I think when you talk about recovery period about something like this, you'll hear that it can be anywhere from a few days to several weeks. It could be someone being at home to someone being in an ICU in a hospital. We don't know the specifics of this pneumonia. You would need to know the specifics of the pneumonia to try and figure out how best to gauge what the recovery is going to be. We do know, again, that even after her diagnosis, she was up and about and doing things, so it's unlikely that this is one of the more severe variants of pneumonia. But it would be important to know what is the particular bacteria or virus that's causing the pneumonia, what is she getting in terms of treatment, and what did her chest x-ray look like? Did it involve her whole lung, this pneumonia, or just a small portion of her lung? Those things would all help decide exactly how quickly she would recover. But I think everybody, Mr. Trump has talked about this, everybody is wishing her well, hopes that she makes a speedy recovery, and all indications are that she'll do just that. So thanks for joining me. Hope to see you again soon.